Lambros, Dr. Baum here. It's Friday, so, like we talked about, I realize the situation that you're in, and I certainly acknowledge the fact that this is a tough spot, and we really don't have a great amount of evidence and data to help guide us. So a lot of this is based on feel. You're talking to the psychiatrist today. You're going to talk to the palliative care doctors. You're going to talk to the endocrinologist. You're going to talk to the anesthesiologist. We're going to come up with a plan together whether surgery is the right thing for you. I agree that I think you are in a really tough spot, and I don't see you getting better on your own. I wanted to show you your film so that you understand kind of the extent of what we're going to be doing here. So first of all, the screws at C2 and C3 have actually ripped out of your neck. So this is not even connected to anything. And then on the other side, the screw is still in the bone, but it's come disengaged from the rod. So this is the reason that your neck is pitching forward. Additionally, you have these compression fractures, which are just a few levels below. So this is T2, this is T3, T4, T5. Now T6 is really bad. T7 has a compression fracture. T8 and T9 have a compression fracture. So we're talking about the next normal level being T10. So the extent of your surgery is potentially the occiput, the base of the skull, all the way down to T10. Okay, so I want you to look. This is over half of your body that we're going to have to secure with metal screws and rods. It's really the only reasonable chance that we have to try and stabilize everything. I think the most important thing for you to do is to understand that doing the surgery part is not the hard part. That's probably the easiest thing that I can do. The issue is going to be how you do under anesthesia and how you recover after surgery. So I want to show you something. This is from the American College of Surgeons Surgical Risk Calculator, okay? This is probably not even a realistic capture of the numbers for you. So they basically are quoting a risk of complication of 35%. 100% you're going to have some complication, okay? So whether it's a pneumonia, whether it's difficult pain control, blood pressure control, infection, urinary tract infection, blood clot in your leg, renal failure, you're going to have one of those. So 100% chance of some complication, okay? They're saying about a 3% risk of death. I think I would probably estimate 3 to 5%. I think that that's reasonable. This is discharged to nursing or rehab facility at 70%. That's 100% because that's where you came from. And the length of stay in the hospital, you can see, is very long. We're talking about, weeks in the hospital. So this is serious stuff. And, I want you to be honest with the psychiatrist. I want you to be honest with yourself. I want you to be honest with Rob and the rest of your family. Really think about whether this is something that you want to embark on. There's going to be no undo button here. And I understand that you have a difficult time living in the situation that you're in now, but things could always be worse. And so I'm not saying that they will be. I want to do everything I can to help you, but I want to make sure that we're all on the same page. This is going to be a really, really rocky road. And again, for us to be able to take care of you properly, you're going to have to let go of a lot of your anxiety and a lot of your control over the situation. So the texting, the emailing, the calling, all that stuff, you're going to have to put your faith in the doctors and the nurses here. And that's part of the deal. So, I wanted to get this video to you so you and the rest of the family can understand exactly what we're embarking on. But this is serious stuff here, Lambros. So that's where we are. We'll talk some more today, and obviously we'll talk more over the weekend. I have you on the OR schedule for Monday. So let's see if that's the right thing, okay? All right, talk to you soon. Bye.